Hello everyone. Today, we're delving into the world of a medication called azathioprine, commonly known by its brand name, Imuran. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Azathioprine, often recognized by its brand name Imuran, is an oral medication classified as an immunosuppressant. Its primary function is to suppress the immune system, which is particularly beneficial in conditions where the immune system is overactive or attacking the body, such as autoimmune diseases and organ transplants. Initially approved by the FDA in the 1960s, it's commonly prescribed for preventing organ rejection after a kidney transplant and for treating severe rheumatoid arthritis. Additionally, azathioprine is used in the management of various autoimmune diseases such as Crohn's disease, ulcerative colitis, systemic lupus erythematosus, SLE, and more. Warnings: Azathioprine comes with several important precautions. It can lower the body's ability to fight infections, so those taking it are more susceptible to infections. It also increases the risk of developing certain types of cancers, particularly skin cancer and lymphoma. Individuals with a known hypersensitivity to azathioprine or its components should avoid taking it. Regular blood tests are necessary to monitor for potential blood disorders and liver toxicity. Before taking this medicine. Before starting azathioprine, several factors need consideration. Inform your healthcare provider if you are allergic to the drug or any other medications. Discuss any existing conditions such as liver disease, kidney disease, or a history of infections. Women who are pregnant, planning a pregnancy, or breastfeeding should consult their healthcare provider, as azathioprine can affect the fetus and is excreted in breast milk. It's also essential to inform your doctor if you have any current or recent infections, if you have ever had cancer, or if you have a genetic deficiency of the enzyme thiopurine methyltransferase, TPMT. Patients scheduled for surgery or receiving vaccinations should inform their healthcare provider about their azathioprine use, as it can affect the body's response. Side effects: all medications can have side effects, and azathioprine is no exception. Common side effects include nausea, vomiting, diarrhea, and loss of appetite. Some individuals might experience more severe side effects such as liver damage, bone marrow suppression, leading to low blood cell counts, and an increased risk of infections. More serious side effects can include symptoms of an allergic reaction like hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. Signs of liver issues such as yellowing of the skin or eyes, dark urine, and severe abdominal pain should be promptly reported to a healthcare provider. Additionally, any unusual bleeding or bruising, persistent sore throat, fever, or signs of infection should be communicated to a doctor immediately. Furthermore, azathioprine may cause serious side effects including pancreatitis, inflammation of the pancreas, which can present with severe abdominal pain, back pain, and vomiting. There's also a potential risk of developing progressive multifocal leukoencephalopathy, PML, a rare but serious brain infection. Symptoms of PML include weakness, vision problems, difficulty speaking, and loss of coordination. Immediate medical attention is crucial if any of these symptoms occur. Interactions: azathioprine can interact with other medications, potentially altering their effects. It's essential to inform your healthcare provider about all medications, supplements, and herbal products you're currently taking. This includes other immunosuppressants, allopurinol, febuxostat, and medications affecting the bone marrow, as these can increase the risk of side effects. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking azathioprine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of azathioprine varies based on the condition being treated, patient response, and other factors. For preventing organ rejection, the typical initial dose is 3 to 5 mg per kilogram daily, with adjustments made based on response and blood test results. For rheumatoid arthritis, the usual dose ranges from 1 to 2.5 mg per kilogram daily. It's important to follow your doctor's instructions and never alter your dosage without consulting your healthcare provider. Avoid: while on azathioprine, it's advisable to avoid exposure to infections. Practice good hygiene, avoid close contact with sick individuals, and stay updated on vaccinations after consulting your healthcare provider. Due to the increased risk of skin cancer, it's recommended to use sunscreen and wear protective clothing when outdoors. It's also wise to avoid alcohol, as it can exacerbate liver-related side effects. FAQ. Many wonder about the age restrictions for azathioprine. Its safety and effectiveness in individuals younger than 18 are not well established for conditions other than organ transplants. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of azathioprine. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.